You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, I'm Dr. Marzell. Welcome to our podcast today. And the subject of today is going to be the importance of lab tests. Now, when your doctor orders checkup lab work, do you sometimes wonder just what it means? And then do you sometimes hear, how's everything look? Oh, pretty good. Do you actually wonder what pretty good means? Today, I'd like to discuss which tests are done in a usual checkup and why. But I'm also going to review some of the not-so-routine tests used to monitor your health. Are you at risk for a bone fracture? Are you in menopause? What's your estrogen level, and is that good enough? What about cholesterol? Are you building plaque in your arteries? Should you have your hormones tested? When and how? Let's start with the basics, and we'll progress to some of the more unusual but important tests. The basic blood count is important because it will show you if you're anemic. Anemia means not enough red blood cells are present to carry oxygen to the tissues in the body. As you can guess, this causes not only fatigue, but can hinder your brain function and impair muscle development. It can also impair sleep for one of the anemia conditions, resulting in something called restless leg syndrome. People who have this can't sleep because their legs are bothering them so much that they have to move them to get some relief. Some of the common causes of anemia are nutritional deficiencies. That would be vitamin B12, folic acid, zinc, B6, and iron deficiency. Let's review why. These vitamins and minerals are used in the production of a red blood cell, the carrier of oxygen. Let's take another example that could cause anemia, that of vitamin B12. Now, if you're eating any type of animal-derived foods, you're probably getting a fair amount of B12. The problem is absorption. B12 cannot be absorbed without a special envoy called intrinsic factor. This is like an escort produced in the stomach. It hooks on to the B12, but the story continues. B12 is absorbed at the very end of the small intestine. So a lot of things can happen before it arrives. One, if you have an overgrowth of bacteria, they may eat the B12 before you can absorb it. That is not very nice. If you are taking stomach acid suppressors like Pepcid, Tagamet, Prilosec, Nexium, they inhibit the ability of your stomach to make intrinsic factor in order to absorb the B12. Many folks are taking these for life. Low vitamin B12 or folic acid, which is another B vitamin, or both, can cause large red blood cells. Iron deficiency causes small cells. Also, anemia can be caused by bleeding or genetic disorders or certain chronic health conditions. So a lot can be seen with a simple CBC complete blood count. I always order a complete metabolic profile with patients, and most doctors, I do believe, order this as well. This shows important electrolytes, liver enzymes and function, kidney health, and a fasting blood sugar level. It's important also to check the thyroid, particularly if you are tired or very anxious. A low thyroid causes not only fatigue, but swelling. So stay tuned for my next podcast, and we'll go from there.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.